we all know becoming a parent can be a daunting experience, and those early days often leave mum and dad so frustrated and wishing for a manual of do's and don'ts. If only one existed. Well, thankfully, one doctor has solved the problem, creating a comprehensive handbook with everything you need to know.
It's called Children's Health A to Z, and author and paediatrician Dr. Leila Masson is here to tell us more. Dr. Leila, thanks for coming in. So this book, it's a guide to happy, healthy children. You've updated it to make it, I suppose, more fresh and relevant with today's information, because so much has changed in the last decade with what we know and how we approach children's health. So where do you start? What's the focus in here?
So the focus of the book really is to provide parents like you and my patients with the very practical solutions for common childhood illnesses and the most effective and most natural approach to these issues. And then also to help parents to become their own child's health detectives, to figure out why their children may be getting one virus after another, or why they don't sleep well, or why they're anxious, and address those underlying issues that they may discover.
So your book looks at nutrition and the environment. We just saw something then come up on the screen. How important is environment, say, when it comes to raising kids?
Well, unfortunately, we are bathed in toxins, right? There are toxins in the air, and the water, and the food. And children are not as good at excreting toxins as we are as parents or adults, because we have stronger kidneys and livers, and we sweat more. So, and those toxins accumulate in children and can affect their growth and their development. Some of them are hormone disruptors, for example, so they really can wreak havoc.
Okay, so that's some of the advice on the screen there regarding how to avoid some of those toxins for children, because they are everywhere. But you also look in this book into anxiety, ADHD, autism spectrum disorder, all of these things that there's a lot more awareness around now. And with that, there's also a rise in diagnoses in Australia. So how would you advise a parent to navigate that system and how to navigate those disorders if they think that they're present in their child? Because it can be really hard to get an appointment and to address that.
Yeah. So, I mean, I think it's really important to have a health practitioner help you figure those things out, but I think there's a lot you can do. So 1 in 14 children now have a diagnosis of anxiety. That's shocking, because many, many more are anxious and don't have the diagnosis yet, right?
That's right.
So, and there are some really practical, simple things you can do to help your child, and that's what's provided in the book. So one thing you will love is that a study showed that the best approach or the most effective treatment for anxiety is actually dancing.
Dancing, there you go. Get them moving.
More effective than an SSRI, and there is a scientific explanation for that. So as humans, we evolved to move a lot. And whenever there was danger, we would get this surge in cortisol and adrenaline, the stress hormones. And then when those are there to shoot blood into your muscles so that you can run away from the danger. But nowadays, we don't run away from the danger, right? The kids mostly sit on their screens.
Sure.
And so the muscles can't break down the adrenaline and the cortisol, and those stress hormones accumulate, and then the stress becomes chronic and causes anxiety. So we need to get our kids moving.
So we need to
dancing.
Dance party after dinner every night.
Or running,
exactly.
like you do.
Well, Dr. Leila, great to have you here. Congrats on the book. We appreciate you being here. The Children's Health A to Z is available for purchase right now. But coming up,